Hello dear students, welcome to Sai Samarth Gynae classes. In this video, I will tell you how to differentiate clinically between 4 cases of adnexal mass. तो हम diagnosis को कैसे बनाएं clinical examination findings के basis पे और history के basis पे भी उस बारे में जल्दी से बात करेंगे. तो प्लीज़ चैनल को सब्सक्राइब करें और शेयर करें और आगे बढ़ते हैं हम. एक्टॉपिक प्रेगनेंसी में भी एडनेक्सल मास मिलता है ना. अनरप्चर्ड एक्टॉपिक है तो हिस्ट्री मिलेगी एमेनोरिया की. हो सकता है एमेनोरिया ना हो और स्पॉटिंग हो रही है उसको ड्यूरिंग द पीरियड, द टाइमिंग ऑफ पीरियड्स, बट द ब्लीडिंग इज़ सिग्निफिकेंटली lesser than her normal cycles. Secondly, you will find that the patient has a history of fainting attacks or chakkar, giddiness, along with that lower abdominal pain. When you do upper abdominal examination, you can find lower abdominal tenderness, which is localized to one side only, which is dull. When you do a PV, there will be cervical motion tenderness. There will be pain on one side where there is mass. And when you perform an ultrasonography, you can find a gestational sac in the mass. तो ये findings हैं in favor of ectopic pregnancy. UPT is positive, faintly positive. When you find it faintly positive, you get a quantitative beta HCG done. And then what you do? You repeat the titers in 48 hours. If you are in any case in doubt, and there will be a less than 66% rise in the titers of beta HCG. That's all about ectopic pregnancy. To make a diagnosis, these are the positive points. Now dear students, if it is a case of fibroid uterus, there will be a history of menstrual disturbances. Will be तो नहीं कह सकते हैं because most of the cases are asymptomatic. But there can be a history of disturbed menses and usually it is menorrhagia. So that is heavy bleeding more than 80 ml per cycle. And then at the same time you will find on per abdominal examination there can be some amount of pain when you press. The history can be of pressing on the bladder, it can be frequent urination, pressing on the intestines, it can be constipation. And when you perform a PV examination, then you will find a mass. If it is a uterine fibroid, of course the mass moves with the movement of the uterus. So the mass is moving with the movement of the uterus, so it's attached or it is originating from it. No other finding, positive finding significant can be found in fibroid. On ultrasonography, you can find a hypoechoic mass and that is uterine fibroid. And now dear students, if it is a case of PID which is causing an adnexal mass, तो history में क्या मिल सकता है? Fever की history, malaise. Fever कितना? 100.4 degree Fahrenheit, which is measured on 2 different occasions which are 4 hours apart, and you find the temperature to be this or more than that. Okay, then you will find complaints of chronic dull ache. तो lower abdominal pain भी हो सकता है और बैक एक भी हो सकता है ना. फिर साथ में आप पर एब्डोमिनल एग्जामिनेशन करोगे तो टेंडरनेस हो सकती है. फिर इनको भी कॉन्स्टिपेशन हो सकता है, टेनेस्मस हो सकता है, और अगर ब्लैडर पे प्रेस कर रहा है और इन्फेक्शन है वहाँ पर तो वो इन्फेक्शन विल स्प्रेड. इट कैन स्प्रेड, इट कैन लीड टू UTI. It can lead to fullness of the abdomen. It can involve other structures. On PV examination, you will find cervical movement tenderness, and this is the characteristic feature of PID. So cervical motion tenderness ectopic में भी है, PID में भी है, पर यूरिन प्रेगनेंसी टेस्ट उधर करा रहे हो ना आप, वो पॉजिटिव रहता है. यहाँ UPT तो पॉजिटिव नहीं है पर सर्वाइकल मोशन टेंडरनेस है, काफ़ी ज़्यादा पेन ड्यूरिंग कॉइटस की हिस्ट्री भी मिलती है, साथ में हैवी वजाइनल डिस्चार्ज की हिस्ट्री मिलती है विच इज़ फाउल स्मेलिंग, और साथ में इंटरमेंस्ट्रुअल ब्लीडिंग की हिस्ट्री मिलती है, हैवी ब्लीडिंग इन बिटवीन द पीरियड्स. ये हो सकता है डिस्टर्ब मेंसेस. सो दैट इज़ PID. And so then when you get a complete blood profile done and you will find that the counts are raised, and you on ultrasound also you will find a different appearance. On PV examination in this kind of mass, the mobility will be restricted. I mean, it can be restricted because fibrosis can develop in cases of chronic PID, and that will restrict the mobility. So ovarian cysts are usually asymptomatic. They are an incidental finding to detect along with an ultrasound which has been advised for a different purpose. And you find that there is an ovarian cyst present. But if at all it is symptomatic, if it is a hormone producing cyst, then it might lead to amenorrhea, it might lead to other features of hyperestrogenism. And ovarian cysts are usually asymptomatic unless and until they get torsioned. So if there is a torsion in the ovarian cyst, then it will lead to a lot of pain, acute abdominal pain and vomiting, and the patient has malaise, and then you have to advise a ultrasonography which might not be able to detect so much. So go for a color Doppler and you will find that there is a torsion of an ovarian cyst. Rest of the findings will be negative. So this is how you make a diagnosis of an adnexal mass. So thanks for listening, and please do subscribe the channel for more such videos.